Jason Gorevic, congratulations. Teladoc priced its IPO today above the range at 19 and it's trading up. Ticker TDOC. So I guess the hard part starts now, right? The fun's over?
Well, I'm not sure how much the going public process is fun, but we see this as just a step in the road. It's an important milestone for the company, thrilled about the outcome, but now we've put the capital into the company to continue to add value for our clients.
Well, you raised $157 million, so you can do a lot with that money. Can you talk a little bit about your technology and how advances in technology really paved the way for Teladoc to become public?
Yeah, sure. So, doctors and patients have been seeing each other, whether in person or remotely, for generations, right? And long ago, it was someone picking up the phone and calling their family doc because they needed help. Well, today we've taken modern technologies to connect patients and physicians remotely all over the country, 24/7, 365. And because we have this great technology platform, we can do it in incredibly rapid time. So, our median response time, usually someone's talking to a doctor in less than 10 minutes. Last year we did that over 300,000 times. This year will be over 500,000.
One would assume this lowers the cost of medicine. I know the Affordable Care Act was supposed to make things more affordable, but that generally just pushed more people into hospitals, covered more people. I would think this would lower costs.
It absolutely does lower costs. It lowers costs for everyone in the system. Employers and health plans who are bearing the cost of those health insurance plans, and consumers who are bearing a larger and larger share of that cost. In fact, it does that by keeping people out of the emergency room. You mentioned the Affordable Care Act. That puts more people into the insured ranks. At the same time, we have an increasing population, an aging population. That puts more and more pressure on the system. We're not minting new doctors every day. The supply is just not keeping up. But we open up more access for consumers, and that drives down costs.
Can you talk more about the doctors? Because if prices are going down, can they make it up in terms of volume? Because they're just sitting in their chair and speaking to people.
Well, so the nice thing is that the doctors who work with us, we have over 700 physicians across the country, all board-certified physicians with an average of 20 years experience. They work with us whenever they want, from wherever they want, and they get paid on a per-visit basis. There's no overhead, there's no hassle, they don't have to fill out any claim forms. They love what they do for us because we drive volume to them, and they get to do what they went to med school for, just practice medicine.
Speak a little bit more about the insurance end of it, because we've seen a whole lot of insurance mergers and insurers chasing insurers over the past few weeks as a result of Obamacare.
So we work with over 20 over 20 health plans all across the country. They build us directly into their benefit plans because it drives down costs, it drives up consumer satisfaction. We have over a 95% member satisfaction rate. And it really solves that access problem. With respect to the merger mania going on in the health insurance sector, we think we're a winner no matter what happens there.
All right, and then finally, what can Teladoc do beyond primary care? I would assume it's fairly easy, maybe not so easy, for a doctor to give a prescription or check out someone if they have a cold or bronchitis, but when it gets a little bit more involved, they need to see a patient.
Yeah, so this year we just launched behavioral health, a big issue across the country that's getting a lot of headlines, and there's really a tremendous, again, supply and demand gap. It's hard to get access to a behavioral health professional. We do that remotely now all over the country. In addition, we're launching dermatology, again, something that's really easily treated remotely by snapping a picture, uploading it to one of our board-certified dermatologists, and letting them diagnose remotely.
All right, thanks a lot for coming on. Congratulations.
Thanks, Greg. Appreciate it.
Thank you for watching The Street.